Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. In the last class, we were discussing about well child visit number 3, that is at the age of 2 years, 2 to 2.5 years, 24 to 30 months. And we have explained that in this particular time, the main focus will be on the social milestones, language milestones, and intellectual impairments. Now, what should be there at the age of 2 years? Okay, so if the child is coming to you at the age of 2 years or 2.5 years, what are the things that you have to ask? Talk to the child at least 2 words. That means talk to the words with the 2-word phrases. Okay, kaha gaya? Where are you going? What is this? Like this, 2 words you have to talk. Okay, and child should able to talk this much. It's not physician who is talking. Child should able to talk with the 2-word phrases. Papa gaya, mummy aya, bhaiya gaya, like that. So 2 words he has to connect together and he has to talk. Similarly, he should indicate the need verbally. Suppose he want the food, I want food. Okay, so verbally, food, khana, or fruits, or whatever, playing articles, anything. So indicate verbally, he should able to indicate by the age of 2 years. He should run well. Child will be run well up to 2 years, 2.5 years. Okay, he can pull down the underpants self. He will remove the undergarments, undergarments by himself or herself. So these are the things which is anticipated, okay, at the age of 2 to 2.5 years. Similarly, what are the things you have to look? He should able to answer the question, what is your name, by this age. Okay, he should able to give the flying kiss or hi-fi response back. Okay, usually the child will do that. Paper and crayon copies the line and circular scribbling will be there. Okay, so papers and crayons he will take and he will hold. He will copy a line or circular lines he will put, or he will scribble in the paper. So this much of activity a child has to do, that you have to look in. Then clear the box with a color box. So if you give a color box with a lot of pencils and all, he will remove that one by one and again he will put back it. So this much he should able to do that. Now, what are things that you have to do, that you have to observe? He should jump on 2 feet. By lifting both the feet, he has to jump by the end of 2 to 2.5 years. Doll, teacup and jar, comb, pretended play. Okay, so he will do some pretended play, and at least he has to name at least one color, black, white, whatever. Okay, and then what he has to do? He has to mingle with the biggest group or smallest group of 2 people or 3 people. He will go there and he will play. Okay, the play may not be coordinated well, but he will be there. Then at this particular age, what are the red flags? Okay, so if there is no in kinship words also, so that's a red flag. Up to 2 to 2.5 year also, if there is no kinship words, it's a red flag. Or not indicating the needs verbally, it's also a red flag. Okay, he is not able to run, but rather he will have waddling gait. That is also a red flag. Okay, and he is not trying to get the attention of the others, not mingling with the peers, and that is also a red flag. By this age, child has to do that. Okay, not trying to get the attention of the others. He should adopt different methods to gain the attention of others. If the child is not doing that, so that means it's a red flag. Okay, he should mingle with other peers of similar age or same age maybe. Usually child will be sent to play school nowadays by this age. Okay, not mingling with the peers, or suppose if the child is frequently falling, so that's also considered as a red flag at this particular age of 2 to 2.5 months, 2 to 2.5 years. Now, one more important thing is toddler with a speech delay. Think of autism always. Suppose if there is speech delay, of course in this case 4 there is no much speech delay. Okay, child speech delay in the sense ma, pa he is not able to say, only cooing is present. So you can consider it a type of little, that means initial part of the speech delay also. Okay, so that being the case, whatever may be the cause for the speech delay, but always you have to think about autism first and you have to rule out autism. because autism is one of the most common cause for a language delay. Okay, so how to identify the autism? By the name itself you can identify. In autism, A stand for he avoid the eye contact, U stand for uses the gestures infrequently, and T for talks late or less, and I stand for isolate self from the others or plays alone, solo play will be there. S means sharing of interest with the parents and others are very poor sharing of interest. M stand for movements, repetitive, peculiar repetitive jerky movements will be there. So this is how you can remember the autism, because whenever there is a speech delay, it may be there, it may not be there, but always rule out autism. So coming back, the same case number 4, in autism the child is not able to speak, we know that, it is okay, but if it is not autism, child uses the gestures to communicate. Now what happens is, if autism, how to differentiate other speech problems with autism? If it is autism, child is not able to communicate verbally or non-verbally both, but only speech problem is there due to some other problem, there is no autism, then child is not talking, but he uses the non-verbal method to communicate with the others. But autism child always stays aloof and plays alone, and it is cut off from this world. There is totally sensory block. Okay. Now we know that there are different methods of screening for autism. We know that. So when we suspect autism, one of the best screening method is MCHAT-R. This is usually applied for 16 to 13 months. Okay, MCHAT method. It contains actually 20 items, and parents will fill it in front of the doctors. Many times doctor will ask and they will fill it. One more screening method is available, that is MCHAT-7 is also available. Of course, this contains only 7 items, which is very sensitive in autism. The number of items are very less, 7 only, but it is very sensitive in autism. One more direct observation screen method is also there. In this case, there will be 3 items will be there. Okay. And first one we will call 3 items will be there in this TDOS, that is direct observation screen method. So first one we will call the name of the child, and we will see how he responds. Second one is we will point at an object and look at joint attention. Okay, suppose in the wall there is a clock is there, the mother will be asked to show the clock to the child, whether the child will follow the mother's finger or not, or child is looking at some other place and mother is looking at the clock, like that. So if child is not able to follow the mothers, that means that joint attention is absent. Okay, joint attention is absent. Look at the eye contact. So during this procedure, so these are the 3 important things that comes under direct observation method. Okay, and direct observation screening method. And if the score is totally 0, then it's typical case of autism. Okay, so this is one of the easiest way. If the score is totally 0, total score is 0, then typically it is autism. App-based screening tool is also available nowadays. App-based screening tool is also available. In this, there is also educating videos are also present to the parents to how to handle the case of the autism. Okay, so this can be used as early as 11 months. We are discussing all these things because in the case number 4, there is little delay in speech. Okay, cooing is there, but monosyllable words are not told even in a 9-month baby. That means we should consider this primary initial part of the speech delay, and if that is the case, you have to always suspect autism. Autism may not be there, but you have to first suspect autism and rule out autism, and then you go through. So the next class we will go for case number 5. Till then, goodbye. Thank you very much. Please don't forget to subscribe to my channel, and also please give your valuable comments. Thank you very much.